Hi, my name is Kimberly Watts. I will be discussing to you in a brief video about the health disparity, one of the health disparities that is happening in Jefferson County, Alabama. What we will do is go through the who, what, when, where, and why, and how. I am going to discuss with you about the infant mortality in Jefferson County. And we're going to, of course, go over who, which is the infants that are experiencing a loss of life unnecessarily. How is there a disparity? There's a disparity because of high poverty rates and poor education. The lack of access due to location in proximity to the metro area is what a lot of the women that are needing prenatal care are experiencing. And there's a prevalence in the Black Belt region of Alabama. Then we have the environmental factors, which are pollution of the air and the lack of trust in the healthcare system. We're going to go into the ratios. We have 12.4 to 1,000 of the births of Black women that are affected, and then we have 4.3 per 1,000 births in the Caucasian women that are affected. So we have to improve on both of those numbers, but even more so, the women of color are being impacted greatly. The infants of color have 3 times the chance of dying before their first birthday, according to Alabama Public Health. What the interventions that we can pursue are public health interviews to gather data so we can improve, community partnerships such as the Health Action Partnership that will help, and education provided by local hospitals and healthcare professionals. When is currently. We need to do something now. And we are in the process of improving upon those numbers. And where we are experiencing these losses in the metro area and in the surrounding hospitals, such as the satellite clinics. And why? Infant death should be prevented to give a child a chance at life. Addressing disparity saves lives of the community and it lowers the cost of health care. Early infant death is indicative to the present and future of the community negatively. It is the lack of access producing poor outcomes in our patients, and that is not our goal. Some helpful steps to advance a positive initiative for this disparity is to expand Medicaid to cover women throughout their pregnancy and afterwards, to ensure that the health of the mother and baby that goal will be met. We need to build maternity care availability by placing clinics in Black Belt regions to assist those mothers that don't have transportation and don't have access. And we can expand the assistance in food provisions to make sure that nutrition is involved in prenatal care. Also, we can stabilize housing and make sure that the mothers have stable living conditions. And also, there is room for us to provide transportation for these mothers. Also, we can provide workforce training and diversity for the healthcare professionals and reward them with CEUs or other perks that they might be interested in. And also, we can strengthen community engagement by allowing residents who are affected by the deficits to participate in helping us to create interventions, create policy, and provide health education that is easily digestible to someone who will benefit from being spoken to on a 6th grade level, so it will be clear and we can provoke questions from them and not be so intimidating. Well, this is just a brief coverage of a big situation, and I am all for the initiatives to decrease the infant deaths in our community. I want to thank you for your time.